DMEK Corneal Transplantation for treatment of Fuchs corneal dystrophy. This is a 73-year-old patient who has a visually significant cataract and Fuchs corneal dystrophy. His vision is blurred and he wants to see his best without glasses. Because he wants the least reliance on glasses, we plan on performing DMEK to treat his Fuchs dystrophy. Then, if all goes well, cataract surgery 1 month later with placement of a panoptix lens implant. This video describes the DMEK surgery and his postoperative result. This procedure is performed with local anesthesia using topical lidocaine and 10 milligrams of oral Valium. There's no IV sedation. A 2.8 millimeter diamond keratome is used to enter the anterior chamber. A reverse Sinskey hook is used to score the corneal endothelium in line with the 8.0 millimeter mark created earlier. We make several passes to score the endothelium thoroughly. In order to obtain better visualization of the anterior chamber, we elect to remove the corneal endothelium with a spatula. Ocucoat is used to coat Bowman's membrane to improve visualization. A corneal hoe is used to remove the 8.0 millimeter host endothelial layer from the eye. 0.12 millimeter forceps with teeth are used to remove the host endothelial disc. Irrigation and aspiration is performed to remove the ocucoat from inside the eye. Any viscoelastic in the anterior chamber may prevent adequate adhesion between the donor tissue and the host posterior stroma. Vision blue is used to identify any remaining tags of endothelium in the area of the future donor site. Myostat is used to constrict the pupil. The pre-cut, pre-marked, pre-stained 8.0 millimeter donor in a Jones tube is injected gently into the anterior chamber. We push additional BSS into the anterior chamber to make sure the donor is completely inside the anterior chamber. We are fortunate in this case that the donor is injected and we're able to see the S stamp indicating that the donor is in the correct orientation with Descemet's membrane on the front side and endothelium on the posterior surface. A 10-0 nylon suture is used to close the primary incision. Two 27-gauge cannulas are used to unroll the donor scroll and to move the donor so that it is centered within the 8 millimeter area marked at the beginning of the procedure. Once we visually confirm that the donor is centered and in the correct orientation, we introduce a 30-gauge cannula and inject a small air bubble beneath the donor to push it up against the posterior corneal stroma host area. We then bury the knot of 10-0 nylon suture. Wait 5 minutes for the donor to adhere to the host cornea, then place a soft contact lens, followed by application of topical antibiotic steroid combination drops. We inspect the eye 1 hour later to make sure the donor is in good position and that the intraocular pressure is acceptable. 2 weeks later, this is the clinical appearance of the eye through the slit lamp. The cornea looks nearly perfect, like a 20-year-old cornea. The donor is barely discernible. The epithelium, stroma, and endothelium are normal. We will wait 3 more weeks, then perform cataract surgery using a panoptix lens to enable this patient to see his best without glasses. DMEK is an invaluable procedure for treatment of Fuchs corneal dystrophy. Thank you for watching this video. I hope it was helpful, and have a wonderful day.